Vimal Kumar. I'm the program director at Finovista and in-country partner lead for MECS program in India. We like to give you big thanks to all of you to joining us today. And we thought that most of you know about the talk series, but still we like to highlight that the MECS program is in India is doing this talk series to making interactive. When we start talking about clean cooking and such kind of subjects, we often forget this. So our idea is to how to bring the regular interaction among the stakeholder and have some regular engagements. So with this background, we started the talk series, which I will be discussing in details also. And as we know that MECS program is 5-year program. And here we like to highlight that what we can actually do together in the sector. So with this, I want to take my screen on presentation mode. Hope it is fine. Yeah. Sir, yes, welcome again. MECS is a 5-year program funded by FCDO UK. The program is pioneering electric cooking worldwide with active intervention in Africa, African and Southeast Asian countries. We at Finovista is in-country partner for MECS program in India. We are a typical Indian consulting firm. We are operating in 4 domains: in-country representation, project management consulting, technology transfer, and capacity building. We have when we talked about MECS program, so we have developed a overall MECS program landscape in India. We identified who are the stakeholder, what are the activities need to be supported, and we have approached to all partners, all possible sects of the segment. So and the activities on the outreach and promotion, we are working with all the people relevant for the sector, like association, the power discoms or utilities, the large implementation company like EESL. On the innovation management side, we try to work with the BIRAC and Electropreneur Park. And happy to share that recently we have concluded our application process for entrepreneurship development program. This is the kind of first in India, so under which we are actually supporting entrepreneurs in clean cooking with 45 days training and 45 days of mentoring with some funding as a grant also. We also provide the scale up and market access support to the device manufacturer. We are working with the different sets of people. On the pilot and demonstrations also, we will going to work very soon with the CESC and Bengal Chamber of Commerce along with the EESL, etc. Enabling the transition required the big leap. And to do this, happy to share that one of the Indian company is winner of the Global Leap Award. On the market expansion side, when we started the program in December 19, we had a very few players in electric pressure cooker, especially around 8 to 10. Now we have over 22 brands operating in India. So this is the clear-cut market expansion we see. Enhanced collaboration, of course, talk series is every talk series is at least we are getting 5-6 requests that can you facilitate the connections and also, which is actually making more interactive. On the policy initiatives and all, we have recommended Government of India in this physical budget to launch a larger program in clean cooking, and we have also recommended adding the electric cooking in the National Electricity Policy 2021. And on the promotion of electric devices, we are working with the EESL, which is the Indian large implementation body, who takes care of larger implementation, and they have been credited bringing the 4-pound LED bulb to just 10 cents. And Go Electric is another pushed by the Government of India to take care of the sector. Another very interesting aspect, like what cookability can be done through the EPC or other electric devices. So we have did a Indian culture study and the e-cookbook. We identified the 20 dishes which is staple and popular food. We did the cooking for the family size of 4 in a 3-liter EPC with a 750 watts and 1300 induction. So we have developed this India e-cookbook, which is out also, and we are going to have a dedicated talk series on 19th of May on this. This is the current talk series we are talking about. So why we are doing the talk series? So I have explained also. So this talk series is basically focusing on the first 12 sessions. So the 12 session which we are doing in a various other sectors, and the idea is to bring different component of the talk series into the discussions. So like first we started with device design. And we did in innovation finance, we did in women in clean cooking, government finance, and today focus is on the impact of COVID. And as I mentioned that COVID has impacted everything, every person, every segment. And this topic is very close to our heart. It is endeavored toward establishing a platform to bring together the different voices in modern energy-based cooking and building critical connections to enable the shift. And especially that I don't want to talk too much on the COVID impact side, because we have a very good panelist lineup. They have did very good work on the ground, and they have a very good experiences. We like to hear from them directly. With this, I like to end my presentation and pass my mic to Nick.
Thank you, Vimal. Thank you. And just to repeat your welcome, I'm pleased to see more and more people are joining as we start to get into this webinar, which should be really interesting. I think my observation about COVID is that it's become such a unifying thing in terms of all the conversations I have, whether it's with people in India, in China, in Africa. It always starts with, and how are you with COVID at the moment? How is your country being affected? How has it affected your family? And so it becomes a real point of connection, and it's a sad and very tragic pandemic, but it has had some benefits in terms of communications, I feel. But today we're going to hear about some of those wider implications of COVID, and particularly how it's affected people's ability to shift in the way they cook from polluting fossil fuels to cleaner sources of cooking fuel. We've got a number of panelists that will introduce themselves shortly, but initially I'm very pleased that we have Dr. Karen Troncoso-Torres, who works at the WHO. She's going to talk about the kind of global perspective. She's not in a position to share a kind of official WHO position on this, as they're still developing that, but I think she's able to speak with some authority. She was for a while in the MECS program, and so has a good understanding of what we're doing and can bring her views from that perspective as well. So just to add, in terms of how we're managing this, I think I'm going to be moderating from here on. If you do have any comments or questions, or would like to make yourselves known to any of the panelists or speakers, put your comments into the chat and an email address if you'd like that. And then we want to encourage people, as Vimal says, to get in touch, to interact with each other, to form new collaborations. And if you have any questions that you'd like to raise, put them in the chat, and I'll endeavour to come back to them if there's time at the end. And I'll be using the little hand up reaction sign to let our speakers know when they need to be wrapping up. But I'm going to hand over to Dr. Troncoso-Torres.
Thank you, Nick, and good afternoon, and thank you to Finovista and MECS for inviting me to this panel. Next one, please. Well, accelerating access to clean cooking is an important step for minimizing the poorest households' vulnerability to the pandemic. The adoption of clean cooking solutions can reduce health risks from household air pollution, support green and healthy recovery, and support economic growth in low and middle income countries. National government, with the support of international organizations and civil society, and with the strong engagement of the private sector, must harness recovery effort to develop and implement regulatory and financial policies that can enhance affordability and better enable and drive the adoption of clean cooking, especially among the most vulnerable population. Next one, please. The lengthy lockdowns changes in humanity mobility and goods deliveries, particularly to the most vulnerable populations in low and middle income countries, were often followed by periods of economic stagnation and disruptions in supply chain. In 2021, this contributed to the deepening inequalities in several areas, including the cooking energy sector. Additionally, the lack of access to modern energy solutions exacerbated by the pandemic is a barrier to achieving several other SDGs, especially for the poorest and most vulnerable populations. Yet, while many have documented the negative impact of COVID-19 on various socio-economic phenomena, empirical evidence of the direct negative impact of COVID-19 on access to clean cooking is very limited. Next one, please. We acknowledge the challenges brought by the pandemic and some opportunities for the sector. As the challenges, we consider that population using polluting fuels for cooking is more vulnerable to severe COVID-19 because of the already limited function of their lungs. There has been a decrease on increased opportunities, a decrease on income opportunities that affect particularly those already living on poverty, and we know that there is a lot of people living on poverty relying on polluting fuels for cooking. Lockdowns reduce mobility and options for biomass collection, meaning some were left with very limited options for cooking. And don't forget the effects on research, the difficulties for conducting field studies, and that is also related with COVID. However, there are some opportunities too. In some sectors, lower access to biomass allows some users to try modern energy for cooking. And we have seen some incipient changes in gender roles, like men staying at home and starting to cook some meals, and we would like to follow with that. And international cooperation is more willing to invest in access to modern energy to reduce vulnerabilities. And I think that's something that we have to consider and highlight in the future. Next one, please. Fortunately, with the rapid use of technologies, some population-based data relevant to clean cooking has been collected during the pandemic. For example, the multiple indicator cluster surveys presented a new opportunity for data collection through a national representative sample of responders using telephone interviews. The 2021 MECS survey conducted in Mongolia incorporated additional questions specifically on the financial impact of the pandemic. As shown on the figure, when disaggregated by wealth, the figure presents the snapshot of differences in clean and polluting fuel usage for cooking in 2018 among people who report their income to be impacted by COVID-19 and those whose income was either not affected by the pandemic or affected by external factors. While the total country access rate to clean cooking increased from 35% to 37% from 1918 to 1920 to 2020, the difference in access to clean cooking by wealth quintile is drastic. In fact, in the two lowest wealth quintiles, use of polluting fuels increased, and there was no improvements in clean cooking access among those whose incomes was affected by COVID. The impact of COVID seems to be most evident in the second wealth quintile. But you can see an increase in the use of clean fuels on the fourth quintile, and such disaggregated insights are essential for interpreting the limited information about the impact of COVID-19 on access to clean cooking. Next one, please. Another example is the transition to clean cooking among refugees and international displaced people during COVID-19 pandemic. Camp residents have quite limited options for cooking fuels and typically either receive firewood as part of aid from humanitarian partners or can collect it from surrounding areas, and sometimes they do both. Recognizing these challenges, several efforts have been undertaken in refugee communities to successfully encourage clean fuel transitions. For example, in Rwanda, the Red Cross donated cooking gas cylinders to refugees in Mahama camp in April 2020. And similarly, in Bangladesh, the UNHCR and the World Liquid Petroleum Gas Association continued a program that aimed to the transition to the Rwanda refugees in Cox's Bazar to FPG during the COVID-19. Next one. The urgency for developing environmentally and financially sustainable models for the provision of clean cooking in humanitarian settings among the most vulnerable population group has never been more evident. And not just for the humanitarian settings, but in general for the whole population of people using or relying on polluting fuels for cooking. Policies focused on increasing clean cooking access should be prioritized as part of the humanitarian agenda and as part of the SDG agenda, but also more broadly, given the critical role they play in building people's resilience to shocks, including epidemics and pandemics. Thank you very much.
Thank you. Thank you. Yes, some alarming findings there, but also, as you say, there are some areas with potential for some positive opportunities for engagement. And I think, as you say, governments are increasingly focused on those parts of the population that have been very severely affected by COVID. But then again, they have limited resources to respond. So I think this discussion will hopefully enable us to tease out some of those key areas for focus and enable us to maybe come up with some suggestions for how a shift going forward needs to be assessed. We're all at a stage now where our countries are arguably looking at post-COVID or looking at how we live with COVID in a world where there are more people who are vaccinated. But I think we still can learn from the COVID experience, and COVID is still very much with us. It's not going to go away, and we're seeing it resurging in other countries, while in some countries it's dropping back. So in the next period, we're going to hear from 4 speakers with different perspectives and different research knowledge about what they've seen in relation to how COVID has affected and related to clean cooking. I'm going to start by introducing or inviting each one to introduce themselves briefly, and then come back around to them all to invite them to make some comments about what they're seeing in relation to COVID. So I think we have all the panelists there and you're all visible now, so that's really helpful. Thank you. Can we start with each of you introducing yourselves, starting with Professor Ravindra Kaiwal? Chance to test your microphone. Professor Kaiwal.
Good afternoon, everyone.
Could you just introduce yourself? I believe you're a Professor of Environmental Health. I've frozen. Yeah.
Ali, I think some network issues, please.
Okay. So Professor Kaiwal is a Professor of Environmental Health at the Department of Community Medicine and School of Public Health in Chandigarh. Yeah, you're back.
Error, and indeed, I'm also so I will introduce again. I am Dr. Ravindra Khewal, Professor of Environment Health, Department of Community Medicine and School of Public Health, PGI, Chandigarh. PGI is known for its community services and patient care. Basically, we have nearly 15,000 footfall here, and you can imagine the monthly and the annual load of the patient here. Now, when we talk about household air pollution and pandemic, we need to understand that the route of exposure, if we talk about, is the same. Either it is COVID-19 or when you talk about the household air pollution. And who is more exposed to it? Basically, you look that where the population is living close, they are more exposed, and this happen in the more vulnerable population or the society. And who is paying the price is the most, you can say, vulnerable. Now, I have been asked to India access to clean energy has been impacted due to COVID. So we understand that the lockdown was here almost 2 years back on 25th March 2020, and it was complete lockdown basically, and there was no, you can say, planning in terms of means how during this period we will ensure sustained supply of the clean fuel. So this basically affected the population to switch back to their traditional practices. Of course, at the same time, because this, you know that in India, the 70% population live at rural location. So this is where we were affected by, you can say, the COVID-19. And
We're losing you, I'm afraid. The signal is possibly not very strong. It might be helpful for you to go to turn the video off if you're not presenting slides. That might be easier for us to hear you.
So this transition to clean fuel was interrupted. So when you say that you have already reached to a stage where the clean fuel is uptake by Ujjwala scheme or various other program of the government of India, then how to ensure that we will have the COVID post-COVID supply? In this regard, basically, we need to work upon so that people make use of this sustained energy transition towards clean energy. We remember, and I hope many colleagues know that Government of India took many initiatives to ensure sustained supply, like there was a Prime Minister Garib Kalyan Yojana, means poor welfare scheme, in which basically they increased the minimum wages of these poor family, and that was almost 500 rupees. And in net term, basically it was 20 rupees per day was increased. Then we also provided under this Prime Minister Poor Relief Fund, basically the free cylinder, which they can use up to, you can say, March 2021. And they were like, we have 14.2 kg cylinder and also some small cylinder. So they also offer this up to, you can say, 8 small cylinder or 3 full weight cylinder. So the government took this initiative, but what happened? There was a price decline during the COVID-19, roughly you can say 35%. But nowadays, if you look at the price before COVID to now, it has increased to 45%. So when this price is increasing, and you are seeing because of the COVID-19, the economy is picking up, but people are still in a phase where they cannot afford it. So the affordability become a question mark, and this may again take people to these old practices. So we have made certain recommendation, basically how they can reach it to, like keeping the fuel cap at this moment, and then also extending these Prime Minister Poor Welfare Fund scheme and ensuring sustained supply, means they at the doorstep of the poor, or you can say at rural location. because in urban area, it is in all metros or major cities, there is no issue basically. But in rural location, in remote areas, it is a major challenge. So through these schemes, basically, we can promote the transition to clean fuel. Now coming back to the another question allied to this was, what are the health impact? So we work directly with the community, and when you ask them, okay, you are cooking, what do you think could be the possible health impact? They relate it only with the respiratory disorder, or you can say illness, and watery eyes. But I hope you remember in 1960, one of our colleagues from AIMS Delhi, she conducted a study. And under this study, means almost I can say 67 years back, she built a relationship that how the rural women who cook in a single house basically are exposed to this polluted air, and then they develop core pulmonary disease, which is normally seen only in heavy smoker. And even after 70 years, we are going through the same, you can say, process and trying to establish. Now, either it is WHO or either it is various other studies in chest or many reviews are available. There is not even a single organ you cannot relate it which is not affected by the exposure to air pollution, or I will specifically say household air pollution. And it will depend upon the moisture, the temperature. Like we have also related in India, you can see the temperature here at noon nowadays is around 40 plus. And then still, if you have to make use of household air pollution, you can think about one side it is the air pollution and another side it is compromised thermal comfort. So these could again enhance the health impact. So this research was also published in Environmental International, apart from this COVID-19 impact and how we can minimize this. So when we say that it is mainly respiratory, so we are communicating with the society and building our study material. I will share the link also, where we are trying to communicate it is less than 25% when you talk about these respiratory element. Majorly, it is the, you can say, other health issues like rheumatic heart disease, stroke, cancer, and preterm birth, premature birth, lower IQ. We have shown this through our research also that the children who are when examined by ourselves, that who make use of this solid biomass fuel, they have 4-point lower IQ. So again, vulnerable population, marginalized population, and then again paying cost at this, you can say, because of the lower IQ. So we need to understand that it is not only that respiratory, the air pollution or household air pollution is a risk factor to all major disease, and we need to establish this through some more, you can say, local evidences. In this regard, we also established the linkage between all cause excess, you can say, mortality with in relation to cancer basically, and proven that yes, there is a excess mortality associated and cancer basically, excess all you can say cancer are associated with household air pollution exposure. Again, this work was published in Environmental International. So if you look at, we have now sufficient evidence that yes, COVID-19 could impact the transition, which was going in a very good, you can say, shape, but because of the impact on the economy, the earning, and you know that some family have even lost their key member. So we will be facing, it will be slowing down the concern. So it is a high time that we focus that how those marginalized population get support and benefit of this clean energy, so that we achieve various sustainable goal on time, or you can say up to 2050. So this is one of the commitment which we should think about to attain SDG, and you can say a better quality of life and improved, you can say, environment and reduction in the climate change impact, so that all have a, as we celebrated Earth Day just few days back, so we can say that we all have a healthy planet for all. Thank you.
Thank you. Yes, a very good summary of the situation in India. Very, very challenging, particularly for the poorer households again. Okay, thank you for that. Do add any specific questions. I'm seeing some points coming through in the chat, so that's great. Keep those coming. Next speaker on the panel is Dr. Simon Batchelor at the Modern Energy Cooking Services Programme. So I'll invite Simon to turn on his video and make himself known to us, and invite him to introduce himself and say a few words about the research that MEC's done and what we found about how COVID has affected the transition to clean cooking. Simon, over to you.
Thank you very much, Nick, and thank you, Dr. Ravinder. I am a research coordinator for the MECS program, Modern Energy Cooking Services, and what we do is, in the title, we do very much focus on modern energy, and that does include all of the higher tier responses like biogas, ethanol, and LPG. But over the last 2, 3, 4 years, we've really begun to focus more and more on electric cooking, because electric cooking leverages the investment that has already been made in electrification. It's interesting, Dr. Ravinder reminded us that 70% of India is rural, and yet actually, you know, all the urban, peri-urban market towns are all strongly connected with electricity now, and it is there to be used with energy efficient appliances, and that's very much what Vimal and Nick and the others are working on. The other interesting thing that Dr. Ravindra said was that during the pandemic, deliveries of LPG became a little bit sporadic, and sometimes there was a falling over of the infrastructure because of lockdowns. People were not able to access and get their cylinders. I'll come to the price in a moment, but it was interesting. This just the infrastructure and the delivery of LPGs. Everybody still had their wire in their house, and if they had been using electric cooking, they would not have to go outside the house to do that. And we see this in other countries where electric cooking had a slight uptake and surge because people were confident that they could. They didn't have to go out. They didn't have to break lockdown. And indeed, the infrastructure remained. It is true that in Africa, the electrical infrastructure, the network, the whole grid is now struggling because a lot of the maintenance and the servicing that was supposed to be done on a regular basis didn't happen during the COVID years. And indeed, many of the African countries rely on tourism. And so the lack of travel and the lack of transport is beginning to really affect their economies. And so, as Nick said, you know, we're in a post-COVID economic recovery, and that's quite difficult. And that brings me to another point that Dr. Ravindra made, which was that during the COVID, you had this extra subsidy on the LPG, and there was a slightly cheaper price. which has now gone up, and again we see that in a number of countries, and but when you look at the price predictions, of course we've also now regrettably had the Ukraine-Russia conflict, and that sent the oil price up at a jump. It was hovering around 60 to 70 for crude oil, and now it's jumped to 100, 110. And when you look at the predictions of where oil prices is going to go over the next 20 to 30 years, it is set to triple, quadruple, and that's without the COP26 removal of inefficient subsidies. One of the things COP26 did was ask that the world move, for the sake of climate change, to remove the inefficient subsidies on oil. Right, so I'm now digressing quite a long way from COVID. So let me just come back. That was in the context that COVID created economic stress, as well as the health effect that Dr. Ravindra was talking about. Women sitting in very small rooms, windowless rooms, and breathing the equivalent of multiple cigarettes. There's also all these economic effects. And I think for us, we're still trying to unpack and understand the COVID economic effects. Thank you.
Thank you, Simon. Yes, there's a lot to get our heads around, isn't there? It's complex, and these things all interact. Okay, that's admirably succinct, and we'll give us a bit more time to have some discussion. Do come back if you have any particular points around the role of electricity in clean cooking, particularly in India. I know there's some comments about what's going to be better, particularly for rural areas where the connection is maybe more variable. Our next speaker is Mr. Srikrant Avi from the Clean Cooking Alliance, and I will invite him to turn his camera on and go off mute and say a few words of introduction, and then share some of the research that you've been doing, I think looking into household air pollution. Is that correct?
Yes, and also especially focused on the venture side of things as well. So I'll cover that topic as well. So first of all, thank you, Nick, and thanks MECS and Finovista for inviting me to this conference. I'm currently lead the venture team at Clean Cooking Alliance. So my role includes engaging with a lot of clean cooking companies which are manufacturing, distributing, or financing cook stoves, and also recently, I was also in the part of the team which led the setup of the Spark Plus Fund, which is a clean cooking investment fund that launched last month. So it's a $70 million fund that will invest in clean cooking value chain across Africa. Now, as part of the venture team, as I mentioned, we support a lot of clean cooking enterprises to help them scale and innovate and attract more capital. So we are dealing with a lot of enterprises in Sub-Saharan Africa and South Asia and Southeast Asia. And we deal with across technologies, including LPG, electric, ethanol, biogas, pellets, even biomass stoves as well. And a lot of our insights are actually built around working with these companies throughout the pandemic. And we had we dealt with some of these companies, we tackled some challenges with them as they were part of our portfolio. Currently, we have roughly around 30 portfolio companies across geographies and across regions as well. So overall, in terms of our insights, I'll capture three different issues. First is on the demand, of what we saw in the demand side. The second is what we saw in the manufacturing and the distribution and financing side as well. So starting with demand, we have seen that in certain regions, we saw some, as we can imagine, we saw tightening household budgets that contributed to families reverting to less clean technology in certain areas. In some of the other areas, we also saw the demand actually increased for clean fuels and stoves because at certain places there were school shutdowns, there were workplace closures, which meant that families were eating more at home and more frequently. And overall, the continuing and in some cases, increasing consumer demand demonstrates the critical role that clean cooking plays in the families, and even in time of extreme financial hardship, we saw that some of the companies actually scaled up their operations. They had to really manage their supply chain around fuel availability as well. Moving to some of the manufacturing companies which either make appliances, which could be stoves, or which could be some of the fuel devices as well. And there we saw that they had the most immediate impact very early on in the pandemic when there were a lot of limitations on, and there were shutdowns and closures. So we saw that there were a lot of limitations in production. There were also limitations in supply chain, especially when companies are dealing with international shipments. So when you're dealing with international shipments, which continues even today, I think that now there's a new reality where the amount of time it takes to ship products is much longer. So I think that is something which companies have already taken into account as well. But we also saw that a lot of these companies were able to adapt very quickly and also address some of the needs around the supply chain. As an example, we work with a company called African Clean Energy, which is a pellet-based manufacturing company in Lesotho and also operating in Cambodia and Uganda. And they had their operations in their manufacturing facility in Lesotho, which was facing severe, in 2020, they had severe lockdown. They were not able to ship their products out of South Africa. They had also some shipments of electronic shipments from China. They were not able to get that in Lesotho. So they had a pre-pandemic plan to open up a second factory in Cambodia. They expanded and they were able to open the factory in Cambodia and cater to the demand in Uganda from there. So that is just an example of how some of the companies have sort of been very flexible. Greenway, which is a company in India operating in Gujarat, operating all over India, but the manufacturing facility in Gujarat, they were facing lockdown issues where there were a lot of issues around addressing concerns of the employees who were supposed to travel and also had some health concerns. So they had some sort of plan to just open up a part of the factory where employees could stay overnight. So they had a temporary sort of place where employees could actually stay overnight and still keeping it very safe as well. And mostly these sort of issues have been faced by companies which have some sort of international shipment. I mentioned African Clean Energy. They source steel from South Africa. They have electronics from Vietnam and China, and solar panels also from China. So companies which have such a complex sort of supply chain, they have faced more issues as well. I'll just wrap it up also by mentioning some of the impact which we felt on the distribution and the financing side of clean cooking as well. Overall, there are a lot of companies which are operating in last mile distribution, which rely on physical connection. So either they sell by group settings or they sell not using a mobile phone. So they're selling by going and meeting people, by organizing them in groups. And they were the people who were hard hit because they had to limit their interaction with the customers, both with their existing customers and any sort of prospective customers. So that was really hit during the lockdown as well. And one of the other important aspects which financing companies also and distribution companies also faced was just the rate of repayment, which has sort of increased significantly from single digit to, in some cases, 15 to 20%, the amount of losses which they have or the amount of recovery which they need to make. So that is something, as a lot of companies and a lot of consumers, they were financially hit hard by the pandemic. So some of the repayments have actually gone down. How the companies have reacted to all these challenges is two aspects. I think that, first of all, in terms of just the external facing world, they have gone digital. So they've accelerated their use of digital tools, including remote training of distributors, digital marketing and sales, and then also integrating mobile money payments in place of cash. And this has set them for a good part, not only to sort of cater to the needs of the pandemic, but overall, I think that this transition has been helping a lot of companies as well. Internally as well, I think that a lot of companies have started utilizing data tools to generate, manage, and analyze customer and operational information. And just in the current environment of uncertainty, use of digital systems is being not only to sort of cater to efficiency gains, or typically it has been looked at as quality control, but also for business continuity as well. So that is also something which we have seen at the company level as well. I'll stop there and I'll look at some of the questions. I'll pass back to Nick and the speakers.
Thank you. Yes, there's a lot there. And as you're suggesting, companies need to be very flexible because the changes and the knock-on effects of COVID have been very wide-ranging, both for companies in terms of their own staff and the people they're seeking to serve. But I absolutely agree that there's a big shift towards digital solutions and digital means of communicating. And I guess, as Simon says, this is where existing infrastructure, if there is cabling in place, can be a lifesaver and help people in severe lockdown. I guess there's the question now is kind of how does all this play out if we move away from a more severe lockdown, but people still be nervous or have nervousness about contagion and new variants coming out. Okay, thank you for that. So our last panelist is Dr. Matthew Shukla. So I invite Matthew to put his camera on and to unmute off. He's at University of Liverpool, the UK National Institute for Health Research. And would you like to introduce yourself and share some of your research findings, please, Matthew?
Sure, thanks very much, Nick, and thanks to MECS for the invitation. So yeah, as mentioned, I'm a postdoctoral researcher at the University of Liverpool in the Department of Public Health Policy and Systems. So my research group is working on a project called Cleaner Africa. So our main focus is on different policy mechanisms and ways to scale up access to clean cooking there. So I have a slightly, I guess, different angle since a lot of the focus has been more broadly. And so I just thought I'd maybe share some of my research there, which has taken place in urban and peri-urban settings within Africa, namely Kenya. So I'll quickly just share my slides. I think it'll be good to see some visuals. Let me share my screen. Let's do this. Okay. So I'll just run through this very quickly. So this work was done in an informal settlement in Nairobi. And what we found in quick summary is that households using LPG, about a quarter of them switched away to polluting fuels. So in this diagram here on the left, I have LPG before lockdown, and households switched to either wood or kerosene. Main reason being here that wood is free and they just gather on the side of the road, or kerosene can be purchased in small amounts. As Simon also mentioned, there may have been concerns with traveling to obtain the cylinder, but also just the upfront cost was too much. And then households also change their type of food. So we look at the link between energy and food here. So as we know, income was the main driver here. That because of lockdowns, many people in informal settlements, because they rely on their daily wages, could not afford certain foods. And so because of that, that was the main cause. But I just wanted to point out that in purple here, I have lower availability of cooking fuel. And so that was a reason reported by about 15% of households. So just to show here that availability of cooking fuel is also impacting dietary changes. I already have that. And these graphs here are showing changes in diets due to cooking as well, or household residents. So something that I don't think was unique to Kenya. As many of us know, because of lockdown, we may have changed where we live, or we had other family members living with us. And so a lot of families saw increased number of people, even if their children weren't in school, for example, so they had an extra meal to cook. They had to cook lunch when previously they may have been provided at school. So just showing here changes in cooking frequency. A lot of families reported less frequent or much less frequent cooking frequency. And so just to show that among those cooking less frequency, there was a much higher percentage that reported changing their diets compared to those that did not. And the same goes for household residents. So every household that reported more residents actually changed their dietary patterns. There was also changes in the source of foods as well, but I won't get into that for the sake of time. And this is just a quick summary of the type of dietary changes as well. And so an issue with concern with access to clean cooking is that you're changing your type of cooking fuel, and because of that, you're also changing the foods you can cook. And so we see kind of a lack of dietary diversity as well. So the more expensive foods in this context in Kenya, in terms of meat or dairy or processed foods like breads, were consumed less, and they just consumed local vegetables. There may be concerns about micronutrient deficiencies as well. This graph I think is really important. I just wanted to highlight here households reporting changes in their income during lockdown. We also asked them to report their LPG consumption. And as Simon mentioned, LPG is the kind of main fuel used in this context in Africa because the infrastructure for electricity is less reliable. So here, looking at changes in income, those that reported no change actually consumed the highest per capita LPG. And as you get down to those that reported less income or no income during lockdown, before COVID, they were consuming the least amount of LPG. So this is kind of highlighting this widened inequity in consumption and access, that the poorest households were disproportionately affected and more likely to use their income. And so the gap between poor and more well-off households in terms of their clean cooking consumption may have actually widened because of COVID. And this graph here is just showing what people report in terms of changes of amount paid for fuel. The green here is showing an increase, And you could see here that LPG among all the fuels used in the community was the one that households report actually increased. So this is why households switched to kerosene or wood. And again, as was mentioned by Simon, that the Russia-Ukraine war and inflation and other issues are probably exacerbating this issue, which was already happening. And this study was conducted in 2020. So as you can imagine, it could probably even get worse. And so this is just a quick summary. About a quarter of households switched their fuel. There was almost universal report in income decline or food insecurity. Dietary changes are more prevalent among households switching their fuel than those that were not. We have these increasing fuel prices, changes in frequency and dietary patterns, all as a result. And then the inequities in clean cooking access. And I'm just going to quickly run through this other study. This was done in Langas in Western Kenya, whereas the previous one was done in informal settlement in Nairobi. And apologies, I'm going fast just for the sake of time. And this is, I thought, interesting as well, just looking at, we talk about economic impacts, time out of work due to COVID-19 lockdowns. So we see that informal sector workers were the most likely to be out of work for more than 2 months. So on the right-hand side, I have time out of work. You can see it kind of goes down as you get to more formal types of work. So if they're a government and business employee, the amount of time out of work was less than informal sector workers in this informal settlement in Kenya. Again, causes of food insecurity. It was, again, universally not enough money, but cannot afford cooking fuel was, again, the second most common factor, about 10 or 15%. So again, we see this link between an inability to afford cooking fuels and then also food insecurity. And finally, I'll just share here quickly, this is the percent of households that switched away from LPG in this community. And again, you could see that it was disproportionately those that were working in the informal sector compared to salaried individuals. And farmers, I think, actually fared well. There's other research showing that they could rely on the food grown on their land and kind of provide them with that buffer for food security. And finally, the months earning lower income, as you would expect, those earning the lowest income for the longest time were more likely to switch away. It was nearly a 4-fold increase. In terms of proportion of households switching was about 20% among those out of work for at least half a year compared to about 5% for 0 to 2 months. So I know I went through this very quickly just for the sake of time, but I also provided links. This data is available. It's been published. So thanks. I'm happy to answer any questions later on.
Thank you, Matthew. Thank you.
Yeah,
nice to have some nice, clear data that we can get our heads around. It's. I think one of the things that's striking me from hearing from all of you panelists is that we're getting sort of what you might call anecdotal or small amounts of information. And how does that add up? And I'd be interested in what Karen thinks the kind of WHO's focus could be and how further research on where COVID has left us would be most helpful, because some of these patterns and shifts are now locked in, a bit like the reference to moving towards more digital communication and new digital delivery models. Some of them are hopefully ones that will not be long term. As people open up and have more options, access to a wider range of foods and fuels and finance. But what are the things that people feel most concerned about that could become long-term areas of concern, and where are the potential solutions? Do people have anything they would like to raise their hand, comment on, or put in the chat? We're getting some comments in the chat about the types of cooking solution that are popular in different areas. Simon, you look like you'd like to say something.
Well, I was going to comment on Matthew's point about dietary changes, because when we have done studies on in Africa particularly, and this may be true, I suspect, very true for India as well, a lot of people are buying, it's not strictly takeaway, but they're buying processed, semi-processed food on their way home from work, which they then reheat, particularly those who are in deep urban situations. And of course, so when we look at Kenya and some of our studies, about 25% of the meals are reheated from either from leftovers from day before or this feature of actually buying things on the way home. And so it's fascinating to see Matthew's data on dietary changes, because that is a potential impact, not just from the income and from the ability to buy food and everything, but this change in pattern, no longer coming home and passing the takeaway or passing your favorite banana fryer or chapati maker or whatever. So yeah, it's and the other thing that I think it was Dr. said about men beginning to cook, and again, this whole fascinating thing about the dynamic within the household changed, because, well, here we all are. I'm sitting in my home. You can see it blurred behind me, and I haven't gone to the office. And so when it comes to lunchtime in a moment, I will wander and go and make myself something. And I think that's a big change from when we used to commute and then go somewhere and come back.
Thank you. Okay, Karen's put her hand up.
Yes, thank you.
Okay, we can hear you. Oh no, you've gone mute. You've muted yourself. You were.
Yes, sorry. Yes, thank you, Nick. I just wanted to to highlight the importance of research and what, as you said already, that many of the things that we are seeing are context specific, and they are anecdotic at this point. But we really need to try to understand better what are the impacts, in order to really leverage this as an opportunity for the sector too. I really want to see it as an opportunity to really highlight the importance of people living on poverty and relying on polluting fuels for cooking, and their vulnerability to these different impacts of the pandemic, not just as a health impact, but in the economic too. Like, they are going to be always the first ones to be hit by something like that. And then it's really something that, as WHO, for example, we always look at the research that is being done in other places in order to try to develop some guidelines. So we really need the research community to apport or to give us more information about what's happening on the field, and that would be really very, very important in the next months, to really learn from this pandemic and to try to avoid it from happening again.
Thank you. Yes, so there's a call there for anyone listening who's got information to share or is carrying out research that relates to this. I think in the last couple of minutes, I'm just looking at the chat. There's some good conversations going on there, but someone was asking about pay-as-you-go, pay-as-you-cook models, and I think we've heard a lot about the economic impacts of COVID and how it's left households poorer, maybe it's lower sources of income, and frustratingly, we in the MECS program, as Simon said, promote electric cooking, which can be a very, very cost-effective way of cooking. It can save you a lot of money if you do have a connection and you have a device, but that requires business models which will enable that to be viable and enable you to spread the cost. And then you can save money on costly charcoal or the time that you might spend collecting firewood. So I think there's a pressure on incomes is something that could drive through some positive shifts. But Matthew's put his hand up, so let's. What would you like to say, Matthew?
Yeah, thank you very much. So coincidentally, in our group at Liverpool has done some work on pay-as-you-go LPG in the same community, actually, and it was done during lockdown, kind of examining consumption, and we actually found that LPG use was sustained during lockdown. So as I mentioned, that about a quarter of households using the full cylinder LPG, where they have to purchase upfront, reduced or stopped their consumption completely. But the pay-as-you-go smart meter data, we actually saw a slight increase. And we actually detected changes in consumption and spending patterns because they use mobile money. So I might just quickly, I have like 2 slides on that. I think it might be useful. I'm a very visual person, so let me just share this quickly. Let me see if I can make this bigger. People can see. So I didn't provide much context. This is kind of pay-as-you-go consumption data. And this graph is showing kilograms of gas per month, so per household. And this is back to when this company called Pago Energy started. And it started in the 2017-2018 with pilot work. And basically just here, this study was conducted in June 2020, but I have kind of per capita monthly consumption. And you could see there are some blips due to differences in the company's interaction. But what I want to point out mostly is that after lockdown, these 4 months, we actually saw a slight increase in consumption, which is in stark contrast to the decrease. And this is in the same community as the research I previously presented. I think what's even more interesting are these graphs. And this is kind of showing before lockdown in green and during lockdown in red. So before lockdown, this is the average amount that families would put into purchase pay-as-you-go. This is in Kenyan shillings. And you could see the green bars are more heavily skewed to the right, meaning before lockdown, they would pay larger sums of money. But the shift during lockdown was to the left, meaning they would put smaller amounts in because they didn't have as much cash on hand likely, but they were still able to pay something and could therefore use their LPG, whereas households that had less money and didn't have access to pay-as-you-go could only had to switch if they didn't have this. So this is kind of showing the change in what pay-as-you-go allows families to do. And similarly, we look at the days between payments, and you could see the frequency of payments increased during COVID. So rather than paying a larger sum over, say, maybe once a week, they were putting a little bit every day or every other day. So this payment flexibility is key, especially to lower income households. So I just wanted to share that since we were talking about pay-as-you-go.
Yeah, no, that's really helpful. And again, thinking about Shikrant and the kind of message to the business community, if they can harness those kinds of financial models and the kind of availability of cash is critical, isn't it? If you're going to reach the communities that are most affected, but that potentially need clean cooking more than ever, the ability to do that. But it does require upfront capital investment, doesn't it? And new ways of mitigating risk if you're letting people pay for things over time. In small payments, and also I think mobile money is absolutely critical because that enables it to be cost effective to actually receive the payments rather than having to go out through agents all the time. Shikrant, do you want to make any comments on that? I see you've I think you've unmuted yourself.
Just added to what Matthew already mentioned, that anecdotally we know that some of the other Pago LPG companies also saw similar sort of uptick in demand. And second, I wanted to comment also on going forward. We see that a lot of these companies, as everybody here is aware, are looking to integrate into carbon markets. And as more carbon, as they try to integrate into the carbon markets, this kind of devices is not only as a pay-as-you-go mechanism, smart meters, but they can be used for real-time monitoring use. And that is also quite a good value because some of the companies, including Pago Energy, currently are sort of struggling to justify the cost of the smart meter, which could be very expensive. It could be up to $50 to $75, which is eventually recovered from the consumer over a period of time. But now with carbon markets, I think that there's a real possibility that it can be the prices could be drastically decreased. So that's another comment I wanted to make. Thank you.
Yeah, no, that's a good point. We're coming to the end, so some people may well have to leave. I'm sure some of you already have. But I'm happy for this to carry on for a few minutes. There was some points made about kind of combining renewable energy generation, sort of solar home systems, maybe local distributed energy generation as a way of, again, trying to reduce the dependence on fossil fuel, on kind of things that have to be brought in, but that can be set up as a kind of infrastructure. So have a look at the chats. There's some sharing of insights and information and studies. But would anyone like to make any final comments or suggestions in terms of taking this discussion forward?
Hi, I'd like to just make one quick comment again. Sorry. So I just also wanted to factor in the what others have brought up in the talk about just like the convenience or having to obtain fuels LPG. So another kind of benefit of this pay-as-you-go is the home delivery of fuel. So a lot of women in our research have expressed either fear of just safety concerns if they have to go out at night. They often have to wait for their husbands to return home so they can go with them, or the husband can obtain the cylinder, or sometimes it's too heavy for them. And so we find that there's sometimes these what we call refill gaps, or just a period of time when they're using LPG, but then they run out and they don't have the opportunity to go get the fuel right away. So again, they have this interim shift. So having the monitoring and just seeing when the fuel is running out and having that delivered to them, and that added convenience. I mean, especially in the context of COVID, you know, if you have concerns, as when was mentioned about going outside, as electricity, you can have it delivered, you know, it's instantly available. And so having delivery of LPG, I think, is a added benefit that these pay-as-you-go companies provide. And so I think that's something else that we have to consider, just thinking about safety and convenience and travel. In urban areas, I think it's getting better that there's, you know, LPG is more accessible, but we do find that there's a correlation between the time traveled to the LPG retailer and consumption. So as they're closer, their consumption increases. And we've seen this across multiple countries in Africa. I think studies in India have shown as well that accessibility is something that is key. And so if you can have it delivered right to your home, that's the most accessible it can be. And so I think that's another factor to consider.
Thank you. Okay. Any other comments or suggestions? One of the things I've been, oh, go on, Vimal. I'm just going to give a little plug. There's a paper that I'm working on why it is a good idea to incorporate monitoring and control facilities when you're designing new electric cooking devices. And obviously the same applies for LPG-based systems. But I think unless you've got a vertically integrated business model where you're both developing the product and putting it out there and maintaining a relationship with the consumer over multiple years, and therefore able to recruit the value of that and claim the carbon credits and allow for long-term payment, it's hard to see the business models for those companies that are more product developers. So I think that's an interesting area for discussion. Anyway, Vimal, you look like you want to wrap up.
Yeah, so thank you, Nick. The session really went well. We got a lot of interest or not. And I regularly see the regular interesting chat is coming on the some of the point which I want to address quickly. So yes, we can happy to facilitate the info, any relationship or any information you want related to India and all that we can do. On one of the charts says that do you like to consider a panel with women? So yes, we have already did our 16th December 2021 panel was women in clean cooking. So all the panelists were women. On the carbon finance, yes, the cost is coming in a big way for the electric cooking. But like Simon mentioned that if you're using the efficient devices, cost is not that much. We have evidence which we have developed the India e-cookbook. Our next talk series also focus on that. There we have talked about the OPEX costing. Maybe a rajma for a family of 4 will cost you less than 2 rupees in electricity. So this is the kind of costing which you're talking on the operational basis. So that we can discuss on the, of course, on the CapEx side, the buying the devices, a lot of people are talking about the carbon finance. Yes, we are trying to integrate the carbon finance, reduction of the devices through the mass procurement, and again using the energy efficient devices. So this may able to help the reduce the cost, and we have the right example. We are working with the EES, Energy Efficiency Services Limited, which has brought the LED bulb cost from $4 to just 10 cents. So this is the power when you have the demand side aggregation, and we have fortunately in India we have that access of that. So we are also working with them to bring the cost on it. So, so with this, it was very good panel, and we like to invite all of you to join on 19th of May. Yeah, Nick, and over to you. Okay, thank you.